Chris, how are you?
A lot of times people get a picture of the pharmacist who counts your pills behind the counter. They think of the pharmacy as a place where you just go to pick up your prescription, but there's so much more to it.
If you have any question, feel free to give us a call.
I always had a curiosity about drugs, medications, and the most interesting part being a pharmacist is the interaction, and I'm more of a people person.
Well, have a wonderful day.
As a pharmacist, it's one of the last healthcare professions where we are so accessible to the public.
Sharon, but I've got some questions for you with this.
Okay, open this up so I can see what's in here.
Roughly about half of our patient base are elderly patients. We have to spend more time with our elderly patients to make sure that they get their prescription and making sure that what they are taking is accurate, and on top of that, they understand. That's the most important thing.
You take one capsule by mouth 30 minutes before meal, okay?
Medication therapy management is one of the roles that I have here as a pharmacist. It's a time where I can sit down with the patient and just thoroughly go through their medications. A lot of the people that I end up doing these medication reviews with, they're 65 years of age and older.
There's some elderly folks that they can't leave their home. If the patient allows us, we always come and visit them, and we find it very effective. One is being compliant. Second is it just brings a lot of satisfaction.
A lot of these people end up being on many medications at that point in their life, so it's just a time that I can sit down with them. So this one is for your diabetes, and look specifically for side effects and interactions and precautions that I want to go over with them.
When we see our patient that come, they've seen like multiple doctors, we make sure that they get the right treatment. So we make sure these drugs are not overlapping.
A lot of times, because they have gotten to an older age, they tend to be on medications that they've just always been on. Doesn't mean that it's a medication that they should be on anymore. So I try to look through all of their medications and see if there's anything that can be taken out and work with the doctors to de-prescribe. If I do something like that, it's going to make it so that there are less side effects, less interactions, and less things to kind of worry about for them. Go ahead and take a look at these things and just make sure that they're all good together.
Sounds good.
We can check out as we age. One of the things that can happen is it can almost turn into like a prescribing cascade. So maybe someone will be started on a particular medication for a specific disease state, and then they might have a side effect. Sometimes the doctor will actually treat those side effects as though it's another condition. And you end up with a situation called polypharmacy, which is basically when someone is on several medications.
And you're going to do your left arm?
I am. There's so much joy and satisfaction in being a pharmacist, and one of the biggest things that I love is being able to actually see a problem, address the problem with the patient, and to be able to work with them to be able to get to where they feel better. That would kind of help figure out why you're having some of these side effects that we talked about before.
Dealing with your elderly patient is the most joyful. They bring smile to you, the most kindest people. And every time you bring their medication, either you deliver or they come and pick it up, they always come with a smile. And I feel privileged helping the elderly patient getting their medication and getting the right treatment.